And now, here's your host, Deborah Duncan.
Good morning and welcome to Great Day, Houston, everybody. It is Medical Monday, and who knows, you might find the answer to something that has been bugging you health-wise. Something that happens to bug a lot of us from time to time. You don't have time to eat, but if you don't get something in your stomach fast, everyone around you will have to pay the consequences because you're about to be downright irritable.
Can we turn the AC up? I'm dying back here.
It's on. Can't you feel it?
Can you feel that?
Jeff, eat a Snickers, please.
Why?
Every time you get hungry, you turn into a diva. Just eat it so we can all coexist.
Turn into a diva.
Put it in your system, cranky pants.
Okay.
Thank you. Better? Better.
Will you get your knees out of the back of my seat?
You're not you when you're hungry. Snickers satisfies.
All right, well, Snickers said it, and now a new study backs it up. Low blood sugar can make people hangry. That's hungry and angry mixed together. So let's find out more in Hot Topics. All right, please welcome our panel of doctors this morning. Orthopedic surgeon Dr. Wayne Alani, cardiologist Dr. Mohammed Shalaby, and hormone specialist Dr. Stephen Hotze. Please welcome them to the show this morning. Why they had to do a new study on this about being hangry, because I think we've known for a long time if you don't get something to eat, then everybody needs to get out of your way. You might eat them, right? Okay, but okay, let's first talk about the science of that, low blood sugar.
Well, I mean, when your blood sugar is low, you feel bad. I mean, obviously, just a diabetic will tell you that, so you need something to get your sugar back up.
Yeah.
And so, you know, I don't know about a Snickers,
but...
And
that's what I'm going with. That's what I wanted. It's really funny, because the problem is we oftentimes know something like a Snickers, you'll grab that first because your body's going, I need ready energy, and it wants the fastest thing it can get. But is that going to last you? And obviously not the best thing for you to do.
It gives you sugar high, then you get the sugar low. You get the rebound hypoglycemia again, so you're happy, hungry, happy, hungry, happy all day if you're eating Snickers all day long.
Yeah,
so.
And that's what part of the problem with America is. The messaging is just grab something on the go. I saw this picture the other day at a gas station. Do we have that pic? Yeah, look at that. Fill yourself up.
Yeah.
There's a Red Bull. We got a soda for you and some Dorito. We got all Snickers. There's a Snickers. Don't be hangry. Eat this stuff right here, which can lead to, of course, other issues.
Like
type 2 diabetes,
type 2
heart problems,
obesity, and the whole 9 yards.
Yeah, okay.
So I'll keep the same, but make it a healthy snack.
Yeah. So fill yourself up on some lettuce and some celery and a carrot stick. We're not doing that. Okay, but all right, speaking of diabetes complications seem to have dropped dramatically over the last 20 years, which is good news, but, you know, we also have to ask the question why. Is it because that we have more medications that people are on to help maintain the disease, or is it because we've done a better job in educating people about losing that weight?
I think it is, for the most part, is because of all of you, because of the education, the great job we did in educating the public about diabetes and its relation to heart disease, stroke, and all that. And people start to make gradual changes, not as fast as we want them to do, but very gradual changes towards changing their lifestyle. So I would give the credit to the people and their work on their lifestyle.
Yeah. And then when we have the medication, the problem that a lot of people still do is by taking the medication, they're maintaining the diabetes when it's something that you can actually get rid of.
You can cure it.
Definitely.
Yeah,
Definitely.
And curing it.
In type 2 diabetes, of course, you can. But most people have type 2 or adult onset diabetes because they're overweight, because they're eating Snickers. They're eating Snickers and filling themselves up. So by appropriately getting down to an ideal body weight, it's amazing how the blood sugar comes into it normalizes in the vast majority of people.
And I find it strange how many people still don't quite understand what diabetes is. I think it's a separate disease, but it is the #1 cause of things like heart disease. Amputations, blindness, renal failure, the whole bit. So you take care of that problem, which is all related to obesity, then you can take care of some of the other problems. Even with you, I mean, if somebody needs a knee replacement, losing weight can certainly help.
Oh, yeah, diabetes is a huge comorbidity for total knee, total hip replacement just because of infection. So we try to get their weight down and get their diabetes. You got to have it controlled to have a orthopedic surgery. There's no question about that.
Yeah. All right. Moving on to alternative treatments. As you know, Valerie Harper was told that she had a couple of months to live. And at that point, she got busy and decided to be a partner in her own health. And this is some of the things that she was saying that she's been doing.
But then the wonderful treatment I got at Cedars-Sinai in Los Angeles, and other exercise, acupuncture, the herbal, Chinese, traditional herbal tea. I think it's helped me. I'm doing everything I can appropriately, and my doctors are supportive.
And I think a lot of times we forget that doctors, we go to you and say, here's my problem, fix it.
Yeah.
But you all want us to be a partner in our health. I know with you, Dr. Hotze, at your center, we actually sign a contract saying, I understand what you want me to do, and I'm going to help you get me well.
That's exactly right. And I think I'm really who is this person?
Valerie Harper. You remember Valerie. Don't act like you're not old enough to remember Valerie Harper. Rhoda.
Okay, Rhoda.
Yes.
Tells you how much I watch TV. Anyway.
You were in medical school at the time. You didn't have time.
Long and the short is, we're going to talk about it later on my segment, but people are sick because they're toxic. Their cells are not healthy. And unhealthy cells lead to disease. And so if we want to cure any disease, we've got to have healthy cells, and there are ways to do that. And it doesn't come through just drugs, which are more toxins. You've got to detoxify the body, and that has to do with proper changing your eating program. And Dr. Mohammed can tell us about that, how Dr. Vern Harnish talks about in heart disease, you can eat your way to good health.
Yeah.
You know, I mean, you can literally clean up your arteries by going on a vegan diet.
Yeah, because when you have a body that's in crisis, and it's fighting this over here, fighting that over here, and fighting this over here, its resources are spread thin when it has to fight things like a serious disease like cancer.
Definitely. And alternative medicine is the future of medicine if we do it. Now, the fact that we don't have big studies to support this, that doesn't mean that it doesn't work. It means that we have not put the study together yet, but it is coming, and we see wonderful results with it so far.
Yeah, like the acupuncture and things like that.
But part of it, like you said, is a cultural thing. People think when you go to the doctor, you're supposed to get a pill.
Yeah.
And that's true with ENT with
or
kids.
Surgery. Yeah,
like my kid's ear hurts, so they need a pill.
Yeah.
Well, I mean, you don't always need a pill. So a lot of it is just preventative, and like Dr. Hotze said, you got to take care of yourself first. So there's no
Well, you said to me, like, we think I have tennis elbow, and so you said, you know, okay, were you gardening or something? And I said,
and she laughed.
I was playing tennis.
No, I was playing in Wimbledon, if you don't mind. No. But anyway, you know, the first question I asked was, okay, is that something that will heal on its own, or do I need any medicine? You say, you know, you can't take a shot to make it heal faster, but it can heal on its own, and I'm fine with that, just healing on its own. All right. Last but not least, RICE, the guideline may delay healing in athletic injuries. We talk about that guideline. It's RICE stands for rest, ice, compression, elevation, wherever we have, you know, some kind of injury to our muscles or bones and things like that. But now, Dr. Gabe Merkin is reversing that thought. He's the one who coined the term RICE. So why? What's wrong with this?
Well, if you look at that study, it was very interesting. He's talking about it curing the problem, but what we use RICE for, rest, ice, compression, elevation, or what have you, is to actually just get rid of the acute phase. And then the theory is to get things moving. So if you have an ankle sprain, you use the RICE for the first few hours, then you get it moving. But in that study, in his original study, he was talking about using it to heal the problem, and that's not what it's for. It's just for acute injuries. So on the football field, you'll see a guy that got his knee tweaked and he'll have a bag of ice on it. He doesn't have a heating pad, if you think about it. So that's what it's for. So I think the way the study was written and what he's talking about is a couple different things.
Yeah, so that's still appropriate, but don't think that's the end of the story.
Right, in the initial phase. But I wouldn't use it for 2-3 weeks thinking it's going to heal it, because it's not.
Because the more you walk on an injury like that, the more you could cause more damage.
That's right, in the beginning. That's right.
All right. Well, doctors, thank you very much. I want to bring up something else that's happening lately also, and that is we're starting to see the resurgence of diseases like polio and stuff come back, measles, and things that we thought were eradicated and gone. And of course, we know with this kind of diseases, they're not gone. They sit there and wait for a host. And so there's a couple things that have happened in this country. One is you've had people who have been against vaccines, feeling that they may cause some other things. And then we have folks who come in from other countries who might not have had access to vaccinations, who bring those diseases back in. So how do we, and this is, you know, I remember a doctor saying to me, I remember the days when we shut everything down and we had babies coming in with polio, you know, symptoms and a whole bit, but we shut the parks down, we shut the pools down, we shut the stores down because everyone was afraid of that outbreak. And because we've done the vaccinations, we have not had that type of situation since then. However, I just want to clarify with you all as doctors how you feel about the whole idea of vaccinations, because there's a lot of information out there. I don't know what's correct and what's not always.
Well, the medical community doesn't either. That's the problem. I think we're over-vaccinated. That's my opinion. I do. I think there's a vaccine for everything. I mean, just as medical professionals, I'm sure they'll agree too, to be in the hospital as a surgeon, you have to have like 10 vaccines. Us.
Well, I grew up around the world, so we were always rolling up our sleeve because, like, you're going to what country? Oh, here we go, right? Yeah.
Right.
I got so many lollipops, it was pitiful. Right. All right.
I probably agree with Shalaby. It says too much vaccines out there, and we have to be very specific when we approach the patient. It looks like we make a rule and we apply it to everyone equally, and that's always not the best approach.
And sometimes it's okay to go through a mild disease, right, to build your immune system. Is that the way it's supposed to work?
Well, it can, but let's go back to the vaccinations. They vaccinate these kids immediately when they're born with hepatitis B vaccine, which makes no sense. The immune system's not even developed yet, and that's a vaccine for a disease you're not going to get unless you have strange sexual habits or use IV drugs. So that's not going to happen with kids. So if you were going to vaccinate them with that, I'm not saying you should. You ought to wait till at least they're mature. 5,
when
6.
It makes sense.
Yeah, but instead of, and who knows the effect that these vaccines have on these little kids at birth. I mean, when their immune system's not developed, it doesn't make sense to me.
Okay, so we want to know your opinion on